Pathophysiology Practice Questions Unit 1, Part 5. Let's go. A key biochemical theme in cell injury that leads to the failure of the sodium-potassium pump and subsequent cellular swelling is A. Lipid peroxidation, B. DNA fragmentation, C. ATP depletion, D. Calcium influx. 5 seconds. Correct answer. C. ATP depletion. ATP is necessary for the sodium-potassium pump to function. In the absence of sufficient ATP, the pump fails, leading to an accumulation of sodium inside the cell, which draws water in and causes cellular swelling. Which of the following accurately describes the relationship between pH and hydrogen ions? A. High hydrogen ion concentrations result in a low pH value. B. Acidic solutions have lower hydrogen ion concentrations compared to alkaline solutions. C. High hydrogen ion concentrations lead to a high pH value. D. Alkaline solutions contain more hydrogen ions than acidic solutions. 5 seconds. Correct answer. A. High hydrogen ion concentrations result in a low pH value. pH is inversely related to hydrogen ion concentration. High levels of hydrogen ions result in a low pH, acidic environment, while low levels of hydrogen ions result in a high pH, alkaline environment. For a patient with hypernatremia, which of the following clinical signs is most likely to be observed? A. Decreased weight. B. Low blood pressure. C. Bounding pulse. D. Muscle fatigue. 5 seconds. Correct answer. C. Bounding pulse. Hypernatremia occurs when there's too much sodium in the extracellular space, causing an imbalance. To balance the electrolytes, water moves from inside the cells to the extracellular space, increasing blood volume. This rise in blood volume boosts cardiac output, leading to a bounding pulse as more blood is pumped with each heartbeat. Additionally, hypernatremia causes cells to shrink as water follows sodium out of the cells. A patient with ongoing diarrhea is being treated for their condition. What acid-base imbalance and electrolyte disturbance would most likely result from prolonged diarrhea? A. Metabolic acidosis and hypokalemia. B. Metabolic acidosis and hypernatremia. C. Respiratory alkalosis and hyperkalemia. D. Respiratory acidosis and hyponatremia. 5 seconds. Correct answer. A. Metabolic acidosis and hypokalemia. Diarrhea leads to a loss of bicarbonate, a base, from the gastrointestinal tract, which can result in metabolic acidosis. It also depletes potassium, leading to hypokalemia. Let's approach this in a practical way, rather than just memorizing. The disorder in question is diarrhea, which is not related to lung function, so it is classified as a metabolic. When there's diarrhea, bicarbonate is lost, leading to a decrease in bicarbonate levels in the blood. In metabolic, acid and bases move in the same direction, so, with low bicarbonate, pH will decrease, leading to acidosis. Therefore, the imbalance in this case is metabolic acidosis. Now, let's see the electrolyte imbalances. With diarrhea, fluid and electrolytes are lost from the body. As a result, you can expect lower levels of electrolytes overall. The most significant electrolyte loss in diarrhea is potassium. Why? This is because the GI tract is rich in potassium, and when diarrhea occurs, potassium is lost in large amounts in the stool. Sodium is largely retained by the body, especially by the kidneys, and while there may be some sodium loss during severe diarrhea, potassium loss is much more significant. Which of the following patients is at greatest risk for magnesium deficiency? A. 85-year-old chronic alcoholic. B. A 85-year-old who frequently uses antacids. C. A 85-year-old recovering from surgery. D. A 85-year-old on a long-term laxative regimen. 5 seconds. Correct answer. A 85-year-old chronic alcoholic. Chronic alcohol use is a common cause of magnesium deficiency, as alcohol can impair magnesium absorption and increase its excretion. Long-term use of laxatives and antacids may also lead to deficiencies, but alcohol is a significant risk factor. Thank you for reviewing with me. If you found this helpful, please consider subscribing to my channel and hitting the like button to support more content like this. Up next, we'll dive into Pathophysiology practice questions, Unit 1, Part 6. Stay tuned.